I've always heard that the worst time to give a talk is just before lunch, followed by the second worst just after lunch. So thank you, Mark, for the schedule.
You were set up, Doc.
So it's my pleasure to talk to you about thyroid problems in old people. Thyroid, very interesting organ, and one of the things that we see in geriatrics, I'm going to talk a little bit about normal thyroid gland function. What is the thyroid gland? What does it do? But also, there's some diseases of the thyroid that present very interestingly in old people. So you have to be kind of on the outlook for that, sort of like with falls. So with thyroid disease, it's not something that presents automatically. You kind of have to go after the diagnosis. But very, very interesting. So we're going to talk about hypothyroid, low thyroid, hyperthyroid, high thyroid. We're going to talk a little bit about thyroid nodules. But again, I'm not going to do death by PowerPoint. We're going to talk a little bit about this because it's important to look a little bit more for it. So thyroid disease in old people, very important. So we see a lot of it. We see hyperthyroid, but even more hypothyroid. Now, why is thyroid disease in old people so much different than thyroid disease in younger people? Anybody have an idea on that?
What is thyroid disease what now?
So if we're thinking about diseases of the thyroid, actually something to kind of think a little bit about, because thyroid disease in younger people is very, very much different than thyroid disease in older people, just by the way it presents. For example, hyperthyroid, if your thyroid, so your thyroid gland is kind of like the accelerator on your car. So if you're hyperthyroid, if your accelerator is going real fast, it's like you can't sit down, you don't sleep, you don't eat. If you're a younger person with thyroid, you have diarrhea, something's going on. You may have AFib, atrial fibrillation, if it's real bad. So hyperthyroid, the thyroid gland sits right here, and it means it's going a mile a minute. Hypothyroid, real slow. It's total opposite. So if your thyroid gland is going real slow and you're a younger person, young under 60, how's that sound? So if you're hypothyroid, you are constipated, you can't get out of bed in the morning, you're real tired, you're just real draggy. That's real important as well, hypothyroid. So if you're a younger person, you've probably gotten to the doctor by the time you say, boy, something's going on. I can't get out of bed in the morning. I feel really draggy. I'm constipated. I have no energy at all. So that's a little bit of the difference. But we'll talk a little bit more about how these are different in old people. Thyroid cancer, frequent in old people. Thyroid cancer is a bad cancer to have in anybody, but it's particularly bad in old people. And then there's a lot of other things like parathyroidism and some other diseases as well. So, but let's digress. Let's talk about how wonderful it is to be taking care of old people. Because that's kind of one of the fun things about geriatrics. You know, if you're thinking about geriatrics, if you are going to do everything by algorithm, you know, your blood pressure is this, so we're going to do this. You come on in and to the doctor's office and you present in this way, well, here's what we need to do. Geriatrics, total difference. And those of you who work with older people know that. it's very rewarding because nothing ever makes sense in a lot of situations. It's difficult to diagnose and treat disease in old people. Sometimes they come on in, and thyroid disease is one of those. They come on in, they present one way, you think, yep, I know what's going on. Total opposite. So it's difficult to treat the disease. They don't present like everybody else. Doesn't make sense.
I had a patient I was working with, this family practice doctor, and this fella comes and he happened to see me like the third time. And my boss had gotten all the cancer screening because he had weight loss. That was his main
Weight loss.
Okay, but he did the CEA and did all these tests for cancer. And I looked at him and I said, you know what, let's get a TSH. Sure enough, he was hyperthyroid.
Yep, yep, very common.
I'm like,
very common. Somebody makes a connection and say, maybe we ought to just look at this. So, compared with younger people, older people, different metabolic rates. They have more comorbidities. So every time a geriatric patient walks into your office, it's an N of 1 because something's going on to make them a little different than everybody else. Either their social situation, either the other diseases that they have, either the medicines that they have, something is a little different. Maybe their function, maybe how they've done in their earlier life, something's different. So more comorbidities, they have different symptoms. Many symptoms we say, oh, it's just because they're old. But that's not a lot of times exactly what you said with, well, I'm really tired. Well, you know, you're old, you know? Well, no, it's not always like that. And they may not be able to give you a good history. A lot of times it's almost veterinary medicine, or it's pediatric medicine, really, taking care of older people. How long? I think one of the very interesting things is when someone comes into our office and they are there for memory difficulties and they come in alone. And we say, well, how long have you had memory difficulties? And they say, I'm fine. So, you know, somebody had a concern at some point, put a consult in, but nope, I'm doing fine. Oh, okay, good. Can you balance your checkbook? Yep, no problem. How's your driving? Oh, it's great. You ever get lost? No. Can you do your own laundry and everything? Yup. Can you tell me what year this is? I don't know. So, you know, there's a lot of very interesting things. So, geriatric presentation of disease is very interesting, but a lot of times it doesn't make sense. So, and also, they can be more sensitive to medicines. So when you treat them, you got to treat them totally different. Instead of saying, yep, we're going to blast you with this big dose of something, you know that you're going to get a call and a few days later, boy, after I took that first dose of that medicine you gave me, I was doing horrible. So may be able to take cross-reacting medicines. We're going to see that a lot in thyroid disease. A lot of times the medicine that you give may cause thyroid disease. They may not take their medications correctly. They may think, you know, one pill's good, but maybe I'll take 2. Maybe that'll be better. Sometimes they can't afford their medications, which is very interesting. So myself as an Air Force doc, a little different, because we just tell them, swing by the pharmacy and pick up your medicines. But you know, I may not have the introspection to know how much would this cost if they were buying it on the economy. A lot of times it doesn't make sense. So we just need to look a little bit more. Sometimes we have to look at their social factors. We commonly think that when a patient comes on into your office, well, they have a network. They have people who care about them. They have someone who calls them. Maybe they have a good degree of function. Maybe they can do their activities of daily living like shopping and their housework and their checkbook and fixing meals and maybe driving. So they can do all those. We sort of think with a younger person, but with an older person we really need to think twice. Can they remember? Can they get here to the doctor's office? So unique set of challenges, but it's wonderful to take care of the folks that we take care of. And I personally take care of, we all take care of the greatest generation. So people who really did a lot of things over and above what we did. I deployed when I was on active duty, but when these people deployed, they deployed with nothing. So it's amazing. Other things to kind of think about. So we got to take care of it. But let's talk about the normal thyroid function, because the thyroid's a great gland. It's kind of a fun gland. So it sits right here, kind of like a U or maybe like a W-shaped gland. You know, you can feel it real easily, but normally, if you feel this area and you don't feel anything, then that's good. But if you feel a lump or a bump, and commonly in old people you can, or if it feels enlarged, then that may be something that we need to look a little bit more about. So again, there's a lot of blood supply to the thyroid gland. The thyroid gland is an endocrine gland, which means that it lives here, but works someplace else. Kind of like the pancreas. So the pancreas sits right here under your stomach, but it works all over your body. Kind of like the testes and the ovaries. They sit in one spot, but they work all over your body. So a little bit different. So the function is an endocrine, produces and stores thyroid hormones. And again, they regulate metabolism. So again, if your thyroid is working overtime, your metabolism is going to be going overtime too. It's going to be working, and you're going to feel a little different. So it traps iodine. So, you know, it's interesting, but around the world, we'll talk about this in a moment, but iodine deficiency is one of the real big reasons, the #1 main reason for thyroid disease worldwide. Well, we in America never have iodine deficiency because all the foods that we have so often have iodine supplementation, and it only takes a tiny, tiny bit. But if you live in a third world country, you may have iodine deficiency. And there's several different thyroid hormones. There's T3 and T4. T3 is about 10 times as active as T4, but we measure T4, free T4, in a blood test, and it's very easy. And again, one of the reasons why we really love thyroid is because it's easy to measure. If you find that thyroid disease is occurring, it's kind of easy to treat. It's not a whole lot of stuff. So we can commonly give them a little thyroid hormone, they get better. Commonly, when folks come on in to see me for memory difficulties, one of the things that can cause memory difficulties is low or high thyroid. So if your thyroid is really sluggish, you feel real sluggish and you can't remember stuff. If your thyroid is going way fast, then commonly you can't think about stuff because you've got all this other thoughts jumbling up in your brain. So that's why we love our thyroids. So here's our thyroids. It's kind of a feedback loop, which is very interesting. Kind of thinks that's how endocrine organs work. They sort of come on up to a certain degree. They make hormone, and when they've made enough of it, they kind of say to the organs that stimulate them, enough is enough, cut back now. So it's kind of like with insulin. So your pancreas makes insulin, so we just ate a nice meal, so our body said, hey, pancreas, we need insulin, because we need to get rid of this sugar that's now in those Jason's cookies. Those are awesome cookies. So the body makes insulin, and but then, you know, okay, well, now my blood sugar is kind of going down a little bit. Okay, cut off the insulin. It's the same thing with the thyroid. The hypothalamus. master gland, the big boss, the big kahuna, generates everything body-wide, stimulates the pituitary gland, the middleman, to make thyroid releasing hormone. It says, hey, we need some thyroid. Okay, great. Thyroid stimulating hormone. Okay, thyroid, do your stuff. Thyroid makes thyroid hormone. Says, okay, we got enough. Feeds back on the pituitary, feeds back on the hypothalamus. Okay, we can shut it off now. So it's very, very highly regulated, but wonderfully regulated. Sometimes we find out that your thyroid makes tons and tons and tons of thyroid automatically just because it wants to. Maybe you have a thyroid cancer. We'll talk about this in a minute. So that's why this is way high. It says to the pituitary and the hypothalamus, enough is enough. Don't give me any more thyroid stimulating hormone because we got enough thyroid here. This goes way up. This goes way down. We'll see this in a minute. Sometimes if your thyroid is dead, you've had radiation, maybe you've had throat cancer, your thyroid has been irradiated, this can go way, way, way up. Hey, thyroid, make more hormone, but your thyroid is dead, and the thyroid hormone is way down. That's something that we'll talk about in a minute. Here's an everyday feedback loop. Okay, so you say, oh, I'm going to go shopping. You stop by the bank, you get some cash. You go shopping, you get lots of stuff. You spend lots of money. Whoop, I'm broke. Okay, feedback, stop shopping. Wait until the next payday. The next payday says, okay, I got money now, so let's go shopping again. So there's feedback loops all over the place. This is way too busy, but basically what it says is, here's the thyroid hormone comes in through a little receptor and goes into the nucleus and does its thing. So it regulates metabolism. So it regulates how fast the cells work. So again, if your thyroid is way low, your metabolism is going to go down and things are going to be really sluggish. If your thyroid is way high, your metabolism is going to speed up and everything's going to go boom, 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 boom. So something just to keep an eye on. Hypothyroid, so low thyroid. You need, hypothyroidism for everyone. So if your thyroid is low and sluggish, most common disorder of thyroid function. So iodine deficiency. We see it worldwide. We never see it here in the U.S. But if you have hypothyroidism and you're, and everyone, if you're a younger person, you might have autoimmune disease. You might have a disease, Hashimoto's thyroiditis, that attacks your thyroid and destroys it. So 60%. So we see a lot of folks with thyroiditis leading to your thyroid is almost dead. It's not making anything. Hypothyroid. In the elderly, thyroid dysfunction is a little different here. It's very common. If we don't do anything about it, if we don't go looking for it, it can really cut you down. But if you're over 60, 10% of females, 2% of males, so a lot more in ladies, but the subtle signs and symptoms of hypothyroid in older people often attributed to normal aging. Gee, I'm really tired. Gee, I'm really constipated. I can't get out of bed in the morning. Well, you're old. No, not necessarily. That's the reason. So things, I'm real sluggish. I'm not interested in stuff anymore. I don't really want to do an awful lot of stuff. So we have to kind of look for it. So causes of hypothyroidism for everyone, for all people, Hashimoto's, autoimmune thyroiditis, kind of like rheumatoid arthritis for your joints, kind of like lupus for your kidneys. It's an autoimmune disease. Sometimes diabetes, diabetes type 1. And you make antibodies against certain things. In this situation, you make antibodies against your thyroid gland, and it burns out your thyroid. Yes?
Is there a familial hypothyroidism?
Well, that's a great question. I'm sure there is.
Because my mother had it, I have it, and my eldest daughter had it.
Okay. Well, a lot of the autoimmune diseases run in families, like rheumatoid arthritis, so that certainly can be. So your body makes antibodies against the thyroid, so the function decreases. And this is sort of like what it looks like. You kind of see, boy, my thyroid's really inflamed. Think about people who you've seen who have rheumatoid arthritis. What happens? Their joints become real inflamed, red, hot, they hurt. You look at them and you say, wow, you must just hurt terribly. So, goiter. So for everyone, so sometimes when we treat people for hyperthyroid, we give them radioactive iodine, which burns out their thyroid. Sometimes if you have throat cancer, you do radiation here, it burns out your thyroid. Sometimes your thyroid never develops. Sometimes you can have pituitary or hypothalamus disease, which also will cause hypothyroidism. But in old people, the autoimmune diseases, very common for old people to have autoimmune diseases. If you do a sed rate on an old person or a C-reactive protein, non-specific tests for inflammation, commonly they will be positive if you're an old person, just because they have a lot of autoimmune diseases. Sometimes medicine's called amiodarone, atrial fibrillation. Amiodarone has a lot of iodine in it. That's the IO, amiodarone. That can cause thyroid disease. Sometimes lithium can, sometimes calcium can. So here's normal people, everybody. Again, weakness, lethargy, constipation, dry skin, hair loss, carpal tunnel, your voice goes down. I'm cold all the time. Think about this. So if an old person came in to see you and they saw all this stuff, would you kind of think, yep, maybe we got to check your thyroid? Sometimes. Sometimes we just attribute it to normal aging. In the old people, mental slowing, cognitive difficulty, sometimes they're depressed, sometimes it's hard for them to get out of bed. So, but again, think about all these very non-specific signs, weight gain or weight loss. Bad hypothyroid. This is what they might look like. This poor gentleman has almost no thyroid function. Hyperthyroid is the opposite. But in old people, hyperthyroid can look like hypothyroid. Hyperthyroid, for everyone, it's a little less common. Graves' disease. Antibody, it's another autoimmune, but instead of destroying the thyroid in Graves' disease, this turns it on. It says, hey, make more thyroid. And again, amiodarone can cause that. Or if you say, hey, I'm taking way too much thyroid, or maybe we're giving you too much thyroid, that's one thing. Thyroid sometimes can cause you to lose weight if you make yourself hyperthyroid. Some people say, that's a way that I could lose weight. Maybe I'll just take extra thyroid. So in most people, tremor. So if you're a younger person and you have palpitations and you're nervous all the time, and you eat all the time but still losing weight, you're probably going to go to the doctor. You're probably going to say, wow, something's going on. Maybe if you look like, whoops, like that. It's called exophthalmos. Very famous. Look at her thyroid down in here. Very famous picture. She's hyperthyroid. You can look kind of around here. You can see every bit of white around her pupils. Same thing with this one. You can see just about every bit of white around those pupils. Kind of a subtle sign that says maybe hyperthyroid. Maybe your thyroid is a little bit high. In old people, if you have atrial fibrillation or your heart's beating real fast, maybe if every time you go to the doctor your heart beats 112 times, we may want to think, gee, maybe you're hyperthyroid. Maybe we ought to just take a look at that. Weight loss in old people, apathy, fatigue, maybe your muscles are weak. Maybe it's not just getting old, but maybe it's thyroid. So we do some tests. The easy way is a TSH, the thyroid stimulating hormone, the one produced by the pituitary gland that works on the thyroid, that says, turn on your thyroid. Also, sometimes you can also do the T4, the active thyroid hormone that's circulating around, one of the active thyroids, T3 and T4. Sometimes if we think maybe they might have Graves' disease or Hashimoto's thyroiditis, maybe we should do some antibody tests or even a scan. And these are the antibodies, so maybe these might give a little bit of an idea on what's going on with your thyroid. This is can be a little tricky when you identify or when you try to figure out what's going on. But if your TSH, your thyroid stimulating hormone, is high, you're low. That's confusing, but it means your body's trying to stimulate your thyroid. It's doing a lot, but it's still not producing, the thyroid's not producing that much hormone, so maybe you're hypothyroid. Same thing with hyperthyroid. Maybe your thyroid itself is making tons and tons of thyroid hormone, trying to shut down that pituitary from making TSH. Maybe you're hyperthyroid. Maybe you've got something in your thyroid that's causing it to work overtime. Is this clear? This can be kind of confusing a little bit. Something you just have to kind of think about for a little bit, and it makes sense. But let's talk about thyroid nodules. This can be scary, but commonly when you examine the thyroid of an old person, you might say, uh-oh, boy, I feel a little something right here, thyroid nodule. Maybe, do you have a little cancer in there? Do you have, or is it just a normal old person multinodular thyroid? So 80% have one or greater, but maybe you can only feel it. I think it's 1.5 centimeters, or there's a certain threshold where you can sort of feel them, but they can be very tricky, very difficult to feel in an old person. But if you feel something that's big, that's hard, stony, if you push on it and you say, oh gosh, that hurts, that can kind of mean maybe that's not too bad. But maybe if you press on it and you say, wow, I can feel like a marble under here, that may be something that's not really, really good. The older you get, you can get another thyroid nodule if you're an old person. So how do we treat it? Well, the easy thing is to just put a little needle into a fine needle, tiny needle, and just try to aspirate some of the cells out. It's very easy. You can do it in your endocrinologist's office procedure. Numb you up a little bit, and then just put a little needle in that and look at it under the microscope. Sometimes you can do ultrasound. Sometimes we use a tracer. Sometimes we do a thyroid scan. So if it's a hot nodule, it's working overtime, that's good. If it's a cold nodule, that's bad. We can work on this, but this is something that may be a little bit more worrisome. Here is a normal thyroid scan. You can kind of see. Here's your neck. It's their W-shaped gland. Here is a hot nodule. So compare that right there. It's a hot nodule that says, wow, maybe you got something that's really going overtime. Maybe we need to give you something to kind of cool this down. Maybe you have a mass right here, a cold nodule, a little more worrisome for cancer. So that may be something where you need to have your thyroid out or radioactivity or some type of treatment for that. So how do we treat thyroid disease? Well, if you're low, give them a little thyroid hormone back, a little thyroid. This is a substantial number of people that you'll be taking care of that will be getting a little tiny bit of thyroid. Look at this, 25 micrograms. Tiny, tiny, tiny doses. You don't need a whole pile of it. And then you just, so start low, start them real tiny, and go on up. So if you're hypothyroid, you don't have enough, give them some back. You can help, you can make them feel better. Gee, doc, I feel so much better. You're so smart. You ever want your doctor to be able to, you know, like, get you in for an appointment like anytime? All you have to say is, gee, doc, you're so smart. Doctors have egos. Gee, how'd you think of that? Whoops. So, if it's a little bit, you know, we might want to just watch it a little bit. Sometimes when you're acutely ill, when you're in the intensive care unit, and somebody says, hey, maybe we'll just check a thyroid. You might find that your thyroid is way abnormal. It's called sick euthyroid. Don't consider that thyroid disease right then. Check them later on. Treatment of hyperthyroid, you're going to have to probably burn your thyroid out. Or maybe it's something that you can treat differently. But, you know, if you have cardiac symptoms, if you have AFib, you know, because you're hyperthyroid, your thyroid's going a mile a minute, your heart's going a mile a minute, calm them down with a little beta blocker or a little metoprolol or something like that, and that can kind of slow their heart rate down, and then treat them. And if you treat them, you're probably going to have to replace them later on. Thyroid nodules, you know, if you do the fine needle aspirate of this little bump right here, and it says everything looks pretty good, you can just kind of follow them and see how it does. But you may need to do surgery or something else with that. You may need to just give them a little thyroid back and slow it down. So, what I wanted to convey to you is thyroid dysfunction, thyroid disease, very interesting. In old people, it presents totally different than it does in younger people. Old people, hyperthyroid and hypothyroid can look the same. Mental status changes, just not feeling well, hard to get out of bed because you're going a mile a minute or you're not going at all. And it's important to just look for it, kind of keep a low index of suspicion on that, and treat them, do the tests and treat them if you think so. And sometimes it makes sense. We have a few minutes, I can entertain a couple questions here. We're running a little ahead.
Do you
Yes?
use armor thyroid very much?
You know, armor thyroid is a very interesting entity. So we see 12.5 or 25 micrograms of levothyroxine. We got to the point where we can really give tiny, tiny doses. And then if we do a TSH and a free T4 on someone who's taking 0.075 milligrams or 75 micrograms, you can say, oh, I'm going to tweak you a little bit and move you up to 88 micrograms, or 88 micrograms. With armored thyroid, it's chopped up animal thyroid tissue, and it's very difficult to regulate. So we really can't get into that much regulation. However, people who take armored thyroid very commonly get a little bit of a buzz from it. So it's something that if you take armored thyroid and you like it, it's very difficult to say, well, I'm going to change over to levothyroxine. So there's a place for it, but it's very inexpensive. But that's the only concern and the only frustration is it's very difficult to really fine-tune that so much. So you may give one lot of armored thyroid and get somebody nicely regulated, and then you give another lot, and it might be a little higher. So that's the only concern with that. But it's good stuff. Other questions about thyroid? I appreciate your attention and your participation in this and our previous talk. And one other thing, at noontime, we also, I forgot to mention, vitamin D in falls. A lot of times, the U.S. Preventive Task Force says that all older people should be assessed for vitamin D deficiency. So if your vitamin D is 30 or below, maybe even 40 or below, you might want to give them vitamin D. Tests have shown that there's a correlation between falls and low vitamin D. We aren't really sure exactly what it is, but we think maybe it might be something to do with muscle strength. We know vitamin D is involved in calcium absorption, so that's why we give vitamin D, like caltrate has calcium and 400 international units of vitamin D. But we think vitamin D may also have something to kind of cut down on falls. So, so check your people for vitamin D if you can. I'm vitamin D deficient. My doctor checked me. I'm 19. I said, well, I got them all always at work, so there's no vitamin D in fluorescent lights. But anyway, so thanks again for your attention.